The Nsuaem Government Health Centre was built more than 35 years ago. Today, it is a pale shadow of itself. The health centre lacks logistics to function properly. One doctor serves 36,000 people in the district. Nsuaem is in the western region of Ghana. Currently, the population in the district is more than 100,000 inhabitants. The Nsuaem Government Health Centre was established in 1980 under the PNP government with support from a late health minister, Dr. Kwame Okran. Only Takwa had government hospital in the district at that time. The health centre was finally completed in 1984 by the elsewhere PNP government. The health centre of Nsuaem serves some 35 communities and also services about 36,000 people within the municipality. Since it was established, no major renovation has been undertaken. A visit to the health centre shows that the building have developed cracks and may collapse at any time. The roof leaks badly and the ceiling is destroyed. The building windows and doors are equally affected, while the building iron rods are rusty. The electrical wiring is also dangerously exposed. Whenever it rains, part of the hospital wards get flooded. Nurses have to resort to buckets to collect the water. This creates discomfort for the patient as a result. The medical doctor of Nsuaem Government Health Centre, Mr. Richard Raymond Akbuto, is unhappy with the situation.
The facility itself has the need to be renovated. Total renovation, wiring, re-roofing, the ceiling, painting, manual patches within the structure itself. I think these are things we need. Apart from that, too, we don't have an official vehicle. Our terrain is said that we have a very bad road network. Some of the communities, when it rains, you can't access them, and these are poor people who need healthcare. Personally, I'm the type who will want to move into the communities, taking health care to the doorstep of the people. But if we should get a pickup that is in good shape, that we can go to the communities and do outreach services, I'll be very glad. So anybody out there who can help us with that, we'll be grateful. We don't have an ambulance here. When we are referring, either you are going to Takrade, or this school. This school for Hunter West is the closest. We share boundary with.
The former assemblyman and some community members are also worried about the state of the hospital.
Development, especially look at the state of the hospital. It leaks. The roofing is so bad. We don't have secondary school here, even though the previous government promised of building a secondary school. The community gave the land, but nothing was done. We even heard on the air that Nsuaem SHS is ongoing, but they saw nothing.
It was realized that some of the medical equipments running into thousands of dollars have been destroyed by the rainfall. The Member of Parliament for Takwa Nsuaem constituency, Mr. George Mrekuduka, spoke to the news team.
In fact, I don't sleep. I've mentioned the road as one of my challenges. Okay. And Nsuaem Clinic is one. Okay. And even that one was my first priority, and that is why the minister came there to cut the sword to start the polyclinic. Okay. Because I was always on them. So it's not something that we've abandoned. Okay. And I know you also one of our key stakeholders. Okay. So wouldn't throw your words into the mud. Okay. We need to really reaffirm by making sure that things are done right. In talk with the health director, and we seriously considering how best we can get the facility renovated. in as much as we would want to wait for the new one, we need to put this one in proper perspective.
Even though the hospital runs 24-hour service, only 1 doctor and 6 nurses are at post.
I am to render service to 31,085 people in 23 communities. And we're not having enough staff. We are running 24/7 services with only 4 enrolled nurses.
Oh, are you sure?
Morning, afternoon, night. 4 enrolled nurses. So these women, some married, have family, they will go be on duty. They will work for 6 days without off. 2-story buildings by the police divisional headquarters that the nurses occupy. That bungalow is in a deplorable state renovation.
The community members are therefore calling on individuals, corporate institutions, and government to come into the aid of the health center.
This is the only hospital that we have in our area, and to wake up and see that it has collapsed, in fact, it will be a disaster to all of us. So we will just pray that the government will listen to us and ensure that this thing will be done faster, so that what we are saying will not come in. The government were sharing police vehicles, but the district police headquarters start from Nsuaem here. But we don't have even one single police van. We don't have one single police vehicle. The one that we are having, it has damaged. In this opportunity, we will find out. Tell the government to get us one police vehicle.
In fact,
at times, the facility gets flooded. We are appealing to the government to come to the aid of the hospital.
The Director of Infrastructure for the Ministry of Health, Mr. Ben Adoma Nkansa, and Public Relations Officer Elom Ametepe reacted to some of the concerns of the health facility.
Nsuaem Hospital is among about 6 hospitals that the government intends, for that matter, the ministry intends to execute. We've gone through all the other processes. Among projects like Akotombra, Elubo, Bogoso, Poho, Wasadunkra, and then Nsuaem. They are part of this 6 hospital project that the government intends to execute. We did an international competitive bidding. It's actually been going to be handled by Vamed Engineering. All the architectural designs have been reviewed, and the contractor has been given an advanced mobilization to move to site on that project. You know, the project, the 6 hospitals, all of them are going to cost about 26 million euros. So averagely, if you divide it by 6, you get the exact number, the exact figure for Takwa Nsuaem. The facility also comes along with it. They are also providing staff accommodation. Now, our policy as a ministry is that we don't do any facility. We don't construct any hospital or any facility without adding staff accommodation to it. You know, we're looking at the period of about 24 months for the completion of the 6 hospitals project.
The hospital.
Well, with Takwa Nsuaem, for instance, last year, the Honorable Minister, Honorable Kukwajimamenu, cut short for construction of a new district hospital over there. So the old one, I'm sure you're referring to the old one. There's a need for rehabilitation, but in that particular case, I will appeal to the district assembly to help put it in shape a little, so that the ministry can also focus on the new project, because we believe that Takwa Nsuaem deserves the state-of-the-art facility.
Yeah. It has not actually been brought to my notice, but now that you've mentioned it, I'll try and discuss with the minister. So I will liaise with local government and see how best they can also address the issue about the minor maintenance at the Takwa Nsuaem.
It was disclosed that malaria continued to be the main cause of outpatient cases reported. Diarrhea, typhoid fever, pneumonia, skin ulcers, and anemia are other cases reported to the health facility. Koku Bolton, GBC, Takwa Nsuaem.